and welcome to your Wellness Wednesday too. Hey, September is Fall Prevention Awareness Month. The CDC actually says 1 in 4 Americans 65 and older takes a fall every year. We've got Megan Tim with us today. We've got Darcy Olson as well. We're talking more about really the significance of that number. Ladies, good morning to you. Thanks for being with us.
Thanks for having us.
So let's talk about this. Why is prevention so important? Megan, Darcy, I don't know who wants to go first.
I'll start.
Sure.
I mean, prevention is huge. When it comes to our aging population, this is one of the major things that we see coming through our doors in our emergency rooms, as well as a concern for a lot of our aging adults in our area in Wisconsin. And so prevention is huge to try to reduce some of those issues that are impacting our aging population.
Okay, can we talk about some risk factors too here that might play a role?
Yeah,
Sure.
go
I
ahead,
can
Darcy.
talk about that.
Sure, good.
So there are both internal and external risk factors. So internal risk factors have to do with exercise or people's physical condition, strength, weakness, that sort of thing. Also coordination, dementia, cognition, just being aware of those kinds of things. Medications come into play. Interactions between medications can affect someone. And then external things are things like clutter in the home or low lighting or just things that you don't see or changes in floor dimensions that a person maybe doesn't detect.
And I'm sure you guys are familiar with this too. Like, I had 2 sets of grandparents, both, quite a bit older. They each had falls and things didn't go well the second those falls happened. Is there anything that we can do to maybe prevent that from happening?
Absolutely. So the CDC has a wonderful checklist that you can utilize for in your home if you want to just double check some of those external factors and risk factors that Darcy was speaking to. Checking your lighting and your rugs and just what's in your home that you can prevent having a fall in the first place. I do think that isolation, we've talked a lot about that before when it comes to mental health in our aging population as well. And when folks live by themselves and they don't always have someone to come in and check in on those external factors in their home, that also plays a part. So there's lots of resources out there to help folks know what's safe in their home and to even have people come to their home and double check that for them as well.
And Darcy, what would you say to somebody maybe who's a concerned family member, who's got somebody older that they know and love, and maybe they're concerned about them falling?
I would look to the resources that are available in their community. For example, here in Dane County, Age Better Today provides free in-home assessments to look for the hazards that could contribute to a fall. And what the research is showing is that if people will implement 1 to 4 interventions that are suggested, they can dramatically decrease their risk. So family members should just look to see what the resources are. I think that's the greatest problem. People are unaware of what the resources are in their community. They haven't looked out there because probably it's on the internet. But also there are a lot of different events that are happening in the community, say in the library. With community information series.
Get rid of those area rugs in the house,
That's
right?
exactly right. Those
Okay.
extra
Get rid
cords.
of area, extra cords and clutter.
Awesome. Ladies, thank you for being with us today. We
absolutely.
appreciate it. Okay, we'll be back after the break. Stay with us.